Welcome to the video on total joint replacements. My name is Leanne. I'm the orthopedic navigator at Northwestern Orthopedics. I work with all of you and your upcoming joint replacements. Throughout this video, you will learn what to expect on the day of surgery, how to take care of yourself after your joint replacement, some equipment that we will be using along the way. Please take notes of any questions that you may have. I may be contacted in the office at 524-8935. My number is also in your total joint replacement binder, along with the majority of the information that you will see in this video. I'd like to thank you for choosing Northwestern Medical Center and Northwestern Orthopedics for your surgical needs. It is required that you have a history and physical to be done with your primary medical doctor for clearance for surgery. This history and physical must be done within 30 days prior to your surgery date. 2 weeks before surgery, you will receive a phone call from a nurse in our surgical services department. During that phone call, they will review general questions and special directions, medical history, your medication list, and when you should stop eating, drinking, and certain medications that you should be stopping. 3 business days prior to surgery is when you will receive a phone call from surgical services with the time of arrival for your day of surgery. There are certain medications that you are required to stop before surgery. Most of these medications need to be stopped 2 weeks before surgery unless instructed otherwise. Medications to stop include aspirin, non-steroidal anti-inflammatories. Some examples are Aleve, Advil, ibuprofen, and Mobic. Also, some supplements we would like you to stop prior to surgery, such as fish oil. Anesthesia also may have additional medications that they require you to stop prior to surgery. The surgical service team will make sure that you are aware of those medications. Those medications will also be written on your list that you receive in the mail with all of your surgery information. Please feel free to call the office if you have any questions about certain medications. Cleaning your body before surgery. If you are having your hip or your knee replaced, we ask that you do not shave the operative leg for 5 days before surgery. When you come into the hospital to do your pre-operative lab work, you will be given 3 scrub brushes. 1 will be for the morning of surgery, 1 for the day prior, and 1 for the day before that. So for example, if your surgery is on Monday, we would like you to take a shower using this scrub brush Monday morning before surgery, Sunday, and Saturday. To start, we'd like you to wash your hair and body like you normally do with regular soap and shampoo, and wet the scrub brush and then turn the water off. Wash gently from the neck down for about 5 minutes. Pay special attention to the area where you will be having surgery. Avoid contact with eyes, ears, and genitals. And then turn the water back on and rinse all of the soap off your entire body. We would like you to pack some items to bring in with you when you come into the hospital. Loose clothing for each day. If you are having your hip or your knee replaced, jogging pants, sweatpants, pajama pants, shorts, something that is loose and easy to pull up and down. If you are having your shoulder replaced, large oversized t-shirts or button-up shirts. Some supportive walking shoes, as you will be walking in the hallways as well as your room. Please make sure that you alert us to any changes in medications when you come in the morning of surgery. You can leave all your medications at home, as we will use our medications in our pharmacy. But if you do have inhalers or eye drops that you like to use at home, you are welcome to bring those in. If you use a CPAP or a BiPAP machine at night to sleep with, please bring that to the hospital with you, and also your patient total joint guidebook. On the day of surgery, when you arrive to the hospital, you will go directly to surgical services for registration. Please bring an insurance card and your photo ID. A staff member will place an ID bracelet on your wrist. This bracelet will contain your birthday and your name. Before any staff member in the hospital does anything with you, They will always be asking you your name and your birthday. This is a safety measure to ensure that we are doing the right thing for the right person. Before surgery, you will be escorted to a private room. At this point, your family may be asked to wait in the waiting room, but they will be invited back to sit with you prior to your surgery. A nurse will help you get ready for surgery by helping you into a hospital gown, taking your blood pressure, checking your heart rate and your temperature. They will be asking you a series of questions and will be starting an IV and giving you some IV fluids. You will also be given some medications that will help with pain and swelling after the surgery. And you will have the opportunity to meet with our anesthesiologist and with your surgeon for any questions before surgery. You then will be brought into our operating room. It does tend to be a little colder in our operating room, but we do have several warm blankets to help keep you comfortable. We will be placing stickers on your chest to monitor your heart during the surgery. You will also have a blood pressure cuff on your arm and an oxygen monitor on your finger. Depending on the type of anesthesia you have, you may have some oxygen tubing placed in your nostrils or an oxygen mask on your face. When your surgery is complete, we will then be moving you to our post-anesthesia care unit. This is where we will start waking you up after surgery. You will frequently have your blood pressure, heart rate, and oxygen levels checked. A nurse will be monitoring your pain level and any nausea. At this point, the surgeon will meet with your family and update them on how surgery went. If your family is unable to stay in the hospital, please leave a phone number where they can be reached. Also, you will be having x-rays taken after your surgery. Once you're alert, awake, and your pain is at a tolerable level, you will be transferred to your private room on our progressive care unit. You'll be transferred by bed to the progressive care unit. We will bring your family with you. A nurse will be in to review your past medical history and to review some questions with you and your family. Nursing staff will be in often for the first several hours to check on your blood pressure, heart rate, oxygen, asking you about your pain level, asking about any numbness or tingling you may be experiencing, and looking at your surgical incision, at your dressing, and looking for any swelling. Pain control is very important after having a total joint replacement. If you are able to keep your pain levels low, you will be able to get more rest, get in and out of bed more comfortably, and be able to do your exercises more easily. Here in the hospital, we use a pain scale of 0 to 10. 0 meaning no pain at all, and 10 meaning the worst pain you've ever experienced. A pain score of 0 immediately after surgery is not a reasonable goal. What we do ask everybody to think about is what is an acceptable score for you after surgery. Most people feel that level is between a 2 or a 3. You will have pain medications ordered for you by your doctor around the clock to help decrease pain and swelling at your surgical site. It is recommended to take this medication as ordered by your doctor. It is best if you ask for any additional pain medication when your pain level starts to rise. Do not allow your pain to get severe. When our pain levels are very, very high, an 8, 9, or 10, it takes a lot more medication and time to be able to get it down to a comfortable level. If you maintain good pain control, it takes less pain medication and less time to manage your pain overall. Please refer to the discharge instructions that are in the back of your blue total joint binder for more information on medications to help with pain control. Relaxation and diversion are also helpful in decreasing pain. You may bring personal items with you to help with this, such as bringing electronic devices, being able to listen to music, reading. After surgery, when you are settled in your room, a staff member will bring you an incentive spirometer. An incentive spirometer is used to help prevent pneumonia after surgery. It helps to open up the lungs and encourages coughing and deep breathing. A staff member will show you how to use this. To start, you will take a normal breath. Place the mouth around the mouthpiece and inhale slowly and deeply, exhaling normally. We do ask that you use this incentive spirometer 10 times an hour while you are awake. If you're a television watcher, every time a commercial comes on, it's handy to grab this incentive spirometer and use it. You'll be using this in the hospital as well as at home. We do recommend using it at home, especially for the first couple of weeks while you're not up moving around as much as you normally would.
After you wake up from your shoulder surgery, you will have a Donjoy Sling in place. It is important that you leave this sling on at all times except for when bathing, dressing, or doing your exercises. You will notice that there is a wedge in between your body and the sling. It is important that this wedge stays in place. When it's time to remove the wedge or to start decreasing how often you use your sling, you will be given instructions by your physical therapist or by your surgeon. It is important when wearing the sling that your elbow is back as far as possible in the sling. We want to make sure that your hand is well supported. We don't want your hand hanging over the sling. That will increase swelling into your fingertips. So make sure your arm is back as far as it can go and your hand is comfortably supported.
As your shoulder heals, you will need to wear a shoulder abduction sling to support and protect it. Abduction refers to moving your arm away from the side of your body, movement that puts stress on your shoulder. The sling is designed to prevent this movement. You will need help putting the sling on and taking it off. Be sure your healthcare team has shown you and your caregiver how to do this. Shoulder abduction slings are available from several manufacturers. We'll demonstrate how to put on this model. A pillow is attached to the sling to hold your arm the proper distance from your body. One strap on the sling goes around your waist. Another goes around your neck. Shorter straps are attached by Velcro to help keep your arm in the sling. To remove the sling, your helper removes the thumb strap, then the strap holding the sling closed. Your helper unbuckles the waist strap. Hold the hand of your healing arm to support that arm. Keep the muscles in your healing shoulder and arm relaxed. Your helper releases the Velcro on the shoulder strap to loosen it, then unbuckles the strap. Keep holding your arm so it doesn't drop. Bend forward slowly, still holding the hand of your healing arm. Straighten your healing arm at the elbow and let it dangle. Your helper then removes the sling. Now we'll demonstrate how to put on the sling. Sit or stand, holding your healing arm against your body. Bend forward, lowering your arm and letting it dangle. If you are sitting, dangle your arm between your legs. Do not dangle your arm to the side. Your helper places the sling around your arm. Grasp your hand and gently bend your healing arm at the elbow as you straighten up. Keep your healing shoulder and arm relaxed. Let the other arm do the work. Keep the pillow snug against your body. Keep the elbow of your healing arm in front of your body. Your wrist should be at the midline of your body. There's a short strap with a fastener attached. Your helper puts this through the plastic rings on the open end of the sling and attaches the Velcro to hold the sling closed. He or she attaches another short strap to close the sling around your arm in the middle. Your helper puts the shoulder strap around your neck. Your helper fastens the strap to the clasp on the sling, then adjusts the strap to support your arm in the proper position and fastens it with Velcro. The strap needs to be tight across the back of your neck to support your shoulder. It's a common mistake to have the strap too loose. That may feel more comfortable, but it doesn't support your shoulder properly. Your arm should be bent at the elbow at a right angle. This takes stress off the shoulder muscles. Now your helper loops the waistband around your back and fastens the clasp to adjust it. He or she adjusts it for a snug fit. This helps keep your wrist at the midline of your body. Finally, your helper attaches a short, thin strap under your thumb. This helps keep your arm in the sling. Your elbow should be in front of your body. Your arm should be bent slightly upwards. Your wrist should be at the midline of your body. Both the shoulder and wrist straps should be snug enough to hold your arm firmly in position. Keep your arm and shoulder relaxed. As you move, the sling might need to be readjusted. Immediately loosen the straps if your arm or hand begins to tingle or feel numb, or if the skin on your hand or arm changes color. It's very important to wear the shoulder abduction sling as long as your surgeon tells you to. Wearing the sling greatly helps with the healing of your shoulder. When you sit, put folded towels behind your elbow to keep it forward. When you lie down, use folded towels to keep your elbow forward. Your physical therapist may give you instructions for using a simpler type of sling when showering. Ask your healthcare provider any questions you have about how to safely put on and remove your shoulder abduction sling.
After your surgery, you will be sent home with the Cryo Cuff. When you wake up from surgery, the Cryo Cuff will already be on your shoulder. It is recommended to ice almost continuously for the first 3 days. After those initial 3 days, it is still recommended to ice 5 to 6 times a day, 20 to 30 minutes at a time. Icing is going to help decrease your pain and decrease your swelling. It is important that when you're wearing a Cryo Cuff, that you do have a barrier between your skin and the cuff. So if you're wearing a shirt, that's okay to put the Cryo Cuff over the top of it, or you may drape a pillowcase over your shoulder just to help provide a barrier between your skin and the ice pack.
Cryo Cuff IC Patient Instruction Video. This device can be cold enough to cause serious injury. Do not use this device if you cannot check your skin conditions frequently. Be sure to read and understand all instructions before use. Additional warnings may be found in the instructions for use. This is a non-sterile prescription device for single patient use only. Be sure to speak with your doctor regarding your cold therapy needs. Warning: read and understand all warnings and instructions for use before using this device. Additional warnings appear in the instructions for use. Do not use this device without a prescription from your physician. Your prescription must state how long to apply your cold treatment, how long your breaks should be, and the length of your treatment time. If you have any questions about your treatment plan, be sure to ask your prescribing physician. Do not use this device if a prescription has not been provided for you or you do not understand your prescription. Sensitivity and susceptibility to cold vary for each person, so remember to frequently check your skin conditions. If you experience increased pain, burning, numbness, tingling, increased redness, discoloration, itching, burning, increased swelling, irritation, or other changes in skin condition under the cold pad and around the treatment area, immediately discontinue use and contact your physician. Be sure to let your physician know if the following conditions apply to you: Raynaud's disease, arthritic conditions, peripheral vascular disease, children under 12, decreased skin sensitivity, poor circulation, compromised local circulation, hypercoagulation disorder, diabetes, or neuropathies. Getting started. Prep the cooler before applying the cuff. 1. Attach the blue hose to the cooler. 2. Fill the cooler with water to the line located inside the cooler. 3. Then fill with ice. 4. Apply the insulation disc on top. 5. Securely attach the lid. The lid should be snug. 6. You can shake the cooler. 7. Allow ice and water to sit for 5 minutes to chill. Always apply the cuff empty. Use only AirCast Cryo Cuffs with the AirCast Cryo Cuff IC unit. Read all instructions supplied with the specific Cryo Cuff before applying. Shoulder application. 1. Make sure your cuff is empty prior to application. 2. Apply the cuff, attach the straps around the torso, and secure in the front and the back. 3. Secure the strap on the side of the affected shoulder, front and back. These straps can be opened as needed to do shoulder exercises. To fill your cuff. Attach the blue tube to your cryo cuff. Listen for a click to ensure proper connection. 2. Lift the cooler 12 to 15 inches above your cuff. This will take approximately 45 seconds. 3. Place the cooler on a stable surface so that the base of the cooler is equal to the cryo cuff to ensure optimal performance. 4. Then simply plug in the power supply to turn on the unit. You will hear the motor turning on and off about every 30 seconds. This will provide you with intermittent compression, which you will feel during the on cycle. While the unit is running, remember to never lift the cooler higher than 4 inches above the cuff, as this can cause excessive pressure. Reduce pressure in the cuff if you experience any discomfort, numbness, or tingling. To do so, simply lower the cooler below the cuff. Warning: please remember to consider the following. 1. Do not use an elastic bandage wrap with the cryo cuff. 2. Dressings under the cryo cuff should be applied lightly. 3. Once the cryo cuff is filled, cooler should be level with the cuff. 4. Reduce pressure if needed. 5. Always empty the cuff after each use. To empty the cuff. 1. Unplug the power supply from the unit. 2. Lower the cooler below the cuff. This could take approximately 45 seconds. 3. Disconnect cuff from blue tube. Troubleshooting. If your pad is not getting cold, make sure there is no water left in the unit or cuff from a previous use. Empty cuff after each use and only apply an empty cuff to the body. Check for kinks in the hose. Make sure to fill the cuff prior to plugging the unit in. Make sure the unit has ice and water filled to the appropriate lines. Check the connections and listen for a click when connecting the hose to the cuff. Make sure the unit and the cuff are set level for optimal performance. If the motor is not turning on, check the power connection. Increase separation between equipment. Plug the power supply into an outlet on a circuit different than other devices. If the motor is not functioning, it can be used as a gravity-fed device. For product support, call 888-405-3251.
After surgery, while in the hospital, you will have a pair of our VenaFlows on your lower legs. These are to help prevent blood clots after surgery. It is recommended that you wear these VenaFlows on your lower legs at all times while not walking. Whether you're lying in bed or you're sitting in your recliner chair with your legs elevated, it's very important to have these on.
On the day of surgery, most patients are allowed to put full weight on the operated leg. You will be out of bed with assistance on the same day as your surgery. Either our physical therapy staff or our nursing staff will assist you with this. Some patients are able to stand at the side of the bed, and some patients are able to walk to the bathroom. Studies have shown patients that get out of bed on the day of surgery ultimately have a better and faster recovery. Everyone will start with using a walker and progress to a cane as long as balance allows. The morning after surgery, blood will be drawn. Your surgeon and/or physician assistant will be around to see you while you are in the hospital. Most patients are able to go home the day after surgery. Some patients are even able to go home the evening of surgery. In order to be discharged home, you must be able to tolerate eating and drinking, going to the bathroom on your own. Your pain level must be under control. You must be able to get in and out of bed safely, and also demonstrate with our physical therapist how to do your home exercises, and the ability to go up and down stairs. Before leaving the hospital, a nurse will review with you your discharge instructions. Also, the medications that you should be taking while at home, and answer any questions you may have. If you do spend the night in the hospital, I myself will also be around to see you the day after surgery, after you've worked with your physical therapist, to ensure that our discharge plan that we have set before surgery is the right and safe plan for you. You will work with a physical therapist while at the hospital for exercises and increasing your mobility. The physical therapist will work with you on how to get in and out of bed safely, do stair training, education on how to get in and out of cars. They will make sure that you are familiar with your home exercise program and any precautions that you may have. We do have large recliner chairs in every room, and it is encouraged that you sit up in the chairs for all of your meals. Prior to this surgery, I have talked with you about our initial plans for physical therapy after surgery. The goal for the majority of our patients receiving a total joint surgery is for outpatient physical therapy. Home with outpatient physical therapy can lead to a quicker recovery and greater independence. Our therapists work closely with your orthopedic surgeon. Safety is our most important thing. If you do have difficulty getting in and out of the house, we will discuss the possibility of getting home health physical therapy in your home. If you are receiving your outpatient physical therapy at one of our Northwestern Medical Center sites, which include Cobblestone, Georgia, and Enosburg, you already have an appointment scheduled for you. If you are receiving physical therapy elsewhere, please call your physical therapy department and set up your outpatient physical therapy appointment. You should have your first appointment anywhere from 4 to 5 days after surgery. If you will be receiving home health services, a referral will be sent to the home health agency of your choice the day after your surgery. Home health will call you prior to arriving to set up a date and time for them to make their first visit. We recommend having someone stay with you or be available to you for the first week after surgery. We do work with you on being as independent as possible for at home. Having somebody with you is helpful for when it comes to meal times, helping switch out ice and ice packs, and somebody to help observe for any side effects that may come along with taking new medications. Having a place set up and ready for you when you get home is also a great idea. That place might be close to the bathroom. Have a table next to you where you can access all of your frequently used items, such as books, remotes, and drinks. Also, meals that are pre-made that just require reheating are very convenient ideas. If you are going to be spending the majority of your time at home, please make sure any dishes, pots, or pans are at a countertop level. That way, you are not needing to bend over to get into cupboards or to reach into cupboards that are high above your head. Please make sure that your home is set up for your safe return after surgery. Remove any scatter rugs that could cause tripping. It is recommended that you have railings on your stairways, grab bars or non-skid mats in showers or tubs, adequate lighting in rooms and hallways. We would like to prevent any tripping from dark hallways if you're up walking in the middle of the night. Beware of animals. Animals tend to be tripping hazards. Please refer to the home safety pages for more suggestions and your total joint replacement binders. Once you go home, it is encouraged that you get up every hour while awake to go for a short walk within your home. Bruising and swelling is to be expected after surgery. You may notice bruising or swelling at the surgical site, or down your leg on the surgical side, or down your arm on the surgical side. When resting, elevate your leg above the level of your heart to help reduce swelling. Icing at the same time will also help. If you're having a knee replacement, do not put a pillow under your knee. Make sure that the pillow is under your heel so that your leg remains straight when resting. Lifting your leg may be difficult after having a total knee or total hip replacement. We will work with you on different techniques that will help assist you to get your legs in and out of bed on your own.
After surgery, you will have a dressing in place that will look similar to this. This dressing needs to stay in place for 1 full week. Your physical therapist will then change your dressing and replace with the same type of dressing. That will remain in place for 1 additional week. At the 2-week mark, this dressing will be removed completely. You may shower as soon as you feel comfortable enough for standing in the shower for that amount of time. We do ask if you shower that you cover this dressing up to help protect it from the water. Some people like to cover the dressing with plastic wrap, or press and seal also is a good choice. We do recommend no swimming in pools, soaking in hot tubs or bathtubs for at least 2 weeks after surgery. It is important that your surgical incision skin is healed before you go into any large bodies of water.
Physical therapy. The following videos will discuss post-surgery shoulder precautions and demonstrate total shoulder replacement exercises. Precautions. Make sure to wear your sling at all times other than for bathing, dressing, and when performing exercises. After surgery, you'll want to avoid actively raising your arm. You'll also want to avoid reaching behind your back. Chair transfers. To get up and down from a chair, you do not want to push up with your surgical arm. Bed mobility. You may initially be more comfortable sleeping in a recliner, but if you are in a bed, make sure not to use your surgical arm to help push you up and out of bed. Total shoulder replacement exercises. The following exercises should be performed within a comfortable range of motion. Do not push through pain and no forceful movements. When doing exercises, it is important to not hold your breath and to perform exercises slowly and gently. It is good to come out of your sling for your exercises. Finger flexion and extension. Actively bend and straighten your fingers. Start by slowly making a fist, hold for 5 seconds, then relax and straighten your fingers. This exercise can be done in your sling or with your arm relaxed at your side. Repeat this exercise 10 times per set. Do 1 set per session. Do 3 sessions per day. Wrist flexion and extension. Actively bend your wrist forward and then back. This exercise can be done in your sling or with your arm relaxed at your side. Repeat 10 times per set. Do 1 set per session. Do 2 sessions per day. Forearm pronation and supination. Start with your arm in the handshake position and gently rotate palm down. Hold 3 seconds. Relax and rotate your palm up gently and slowly. This exercise can be done in your sling or with your arm relaxed at your side. Repeat 10 times per set. Do 1 set per session, and do 2 sessions per day. Wrist radial and ulnar deviation. Gently and slowly move your hand towards your pinky and then back towards your thumb, moving it side to side. This exercise can be done in your sling or with your arm relaxed at your side. Repeat 10 times per set. Do 1 set per session, and do 2 sessions per day. Elbow flexion and extension. Gently and slowly bend your elbow, bringing your hand towards your shoulder. Hold for 3 seconds. Then gently and slowly relax and straighten your elbow. Repeat 10 times per set. Do 1 set per session, and do 2 sessions per day. Pendulum exercises, side to side. Bend over supporting yourself, resting on your non-surgical arm. Let your surgical arm hang loosely. Do not actively move your arm. Instead, move your hips and body side to side. Allow your arm to loosely swing side to side. Repeat 10 times per set. Do 1 set per session and 2 sessions per day.
After surgery, it is important that we prevent any blood clots from forming. When blood clots form, they form in the calves of our legs. The risk of this is that blood clot could then travel to your heart, your brain, or your lungs, causing death, heart attack, or strokes. Having a total joint replacement surgery increases your risk of having a blood clot. Also, not getting up and walking around as you normally do also puts you at a higher risk. We like to prevent blood clots, 1, by having you take an aspirin after surgery once a day. If you normally take blood thinners, we will restart you on your regular blood thinners after surgery. Getting up and going for a short walk around your home will also help circulate the blood in your body, and also ankle pumps as demonstrated in the physical therapy PT video. One way that we like to prevent blood clots is using our home compression devices. Our home compression devices will be delivered to you while you're in the hospital after surgery.
You have been prescribed a triple play VT home care kit to use after surgery because your physician has identified you as a high risk for DVT, or deep vein thrombosis. Without proper preventative care, DVT can be the catalyst for several life-threatening complications. DVT is a blood clot that forms in one of the body's deep veins, usually in the lower leg. This clot, if not avoided, can travel to the lungs and trigger a pulmonary embolism. This can cause chest pain, severe breathing problems, and even death. Annually, DVT cases result in 300,000 deaths. That's more fatalities than breast cancer, AIDS, and highway accidents combined. Those at the highest risk for DVT are patients who are recovering from surgery. The triple play VT is a convenient and effective form of preventative care. The sleeves use alternating sequential compression on the lower legs to stimulate blood flow during periods of immobility, greatly reducing your risk for DVT. Unlike prescription medication, this mechanical compression is safe and effective therapy with no side effects. The lightweight triple play VT and calf sleeves are comfortable and easy to use at home after your surgery. The triple play VT comes with 2 calf sleeves. Wrap one sleeve around each calf with a hose in back and pointing down, and secure with the Velcro tabs. The sleeve should fit snugly. Make sure the thumb tabs are depressed on the pump ports and connect each hose to the triple play VT into the ports marked Leg 1 and Leg 2. Make sure they click into place. Press and hold the power on/off button until the display reads on. This will automatically start both DVT ports. You will feel the compression begin, alternating between legs. The pressure should be comfortable and not too tight. At the end of your prescribed treatment period, return the machine and power cord in the prepaid address mailer using the instructions in your kit. If your triple play VT unit will not turn on, the battery may not be fully charged. Connect the power adapter to the unit and plug into a wall supply for a fresh charge. You may use the unit while it's being charged. If you cannot feel pressure on the calves, the sleeve may not be wrapped tightly enough, the air tubes may not be fully connected, or the sleeves may be damaged. Ensure that the sleeves are connected and wrapped properly. If this issue is not resolved, call customer service at 800-994-0464 for replacement sleeves. If the pump shows a high pressure alarm, remove any kinks from the tubing and be sure they are not tangled or constricted. Turn the pump off and back on again. If the pump shows a low pressure alarm, ensure that the tubing is properly connected and the sleeves are wrapped tightly enough to fit 2 fingers between the wrap and the skin. Turn the unit off and then back on to try again. If a low alarm persists, call customer service. A BL alarm indicates the battery charge is low. Connect the charger to a wall supply to recharge. If the pump is no longer charging, contact customer service. Transitioning home after surgery should be a time of recovery, not risk. It is extremely important that you follow your physician's advice to help prevent this life-threatening condition. For questions about getting started with your DVT prevention therapy, talk to your healthcare provider or call 800-994-0464.
The home compression devices are ordered by your surgeon to be worn after surgery. We would like you to wear these home compression devices on your lower legs for the first 30 days after surgery. We'd like you to be wearing them whenever you're not up walking around. That does include nighttime when you're sleeping. Included in the box that comes with the device is directions on how to use the device, as well as information on how to prevent blood clots. After the 30 days, this device does need to be returned to the manufacturer. You may do that one of 2 ways. Everybody has a follow-up in the office around 4 weeks after surgery. You are welcome to bring the box and all of its contents into the orthopedic office, and I will make sure to mail it back to the manufacturer. You also are welcome to do that yourself. There are instructions on the inside cover on how to return the device. The manufacturer would only like the device box and the charger back. We do not return the wraps. There is a pre-stamped envelope that does come in all of the boxes as well. This device is treated just like a medication where it does require a prescription. We do bill your insurance company for the use of this device. When the device is brought to you while you're in the hospital, you will have a form to sign. Your signature on the form will represent that you received a box, that you understand that the box does need to be returned to the company after you are done using it. It also gives permission to send your insurance information and any medical information to this company as well. If your insurance does not cover this device, the company will charge you up to a $145 rental fee for the month. If you have any questions or concerns, you are welcome to contact myself or the company. When you come into surgical services to do your pre-surgical blood work, you will be handed a questionnaire. The questionnaire is called a global health form. This global health form is similar to the questionnaires you receive in your doctor's office. What we would like you to do is go through and mark down how you feel your physical, mental, and emotional health is.
Hi there, I'm Katie Montang, one of the anesthesiologists here, and I'm going to talk to you about the anesthesia for your upcoming shoulder surgery. So for your shoulder surgery, the main anesthetic is general anesthesia. That means you will have you'll get an IV, the first thing that you get here, and then through the IV, we'll be able to give you medications to keep you nice and comfy and get you off to sleep under general anesthesia. Once you're off to sleep with your IV medications, then we will put in a plastic breathing tube that goes in your mouth and sits in your throat. You're not aware of that breathing tube going in, and you're not aware of that breathing tube coming out. Then we take over for you with our breathing machine. That being said, that you'll stay asleep with general anesthesia. Most people are comfortable and understand what general anesthesia is, either from having it themselves or having friends or family members having had it in the past. So the risks associated with general anesthesia that we talk about on our consent form are the risk of obviously a sore throat, because your body knows that tube's not supposed to be there, even though you're not aware of it there when it's there. There's the risk of dental injury, because we have to work around your teeth to put that tube in. So if you have any loose or wiggly teeth, anything like that, please make us aware on the day of surgery. There's the risk of nausea, vomiting. There's the risk of eye injury, because most things people want to do when they wake up is rub their eyes. And then, of course, there's always the remote risk of heart attack, stroke, death. Clearly, it's safer than driving your car here, getting yourself to the hospital. Otherwise, we wouldn't do this. Other piece of shoulder surgery that we like to chat about is something called a nerve block. So your orthopedic surgeon will recommend having a nerve block. We put it in prior to going back to the operating room, and we do it with you awake, but we do give you some medication to make you not care so much about the procedure. What happens with the nerve block is we find the nerve bundle that feeds your shoulder using an ultrasound. And the nerve bundle that feeds your shoulder is actually right up here in your neck. So we'll use an ultrasound or a nerve stimulator to find that nerve bundle. Once we do, we will place some local anesthetic around that nerve bundle. The goal is to bathe the nerve bundle, not poke the nerve bundle. That is why we keep you awake enough to tell us if we get too close. If we got too close to that nerve bundle, it'd feel kind of like a funny bone sensation, which you're able to tell us. We do these nerve blocks in kids as young as 12, and people tolerate it just fine. The nice thing is the concoction of local anesthetic that we use to bathe the nerve bundle is made to last about 18 to 24 hours. So the goal is to really get you a nice, comfortable night so you can sleep without needing a ton of pain medications. Of course, pain medications come with a whole host of side effects, like respiratory depression, so not breathing as much, not taking as big of deep breaths, so lower oxygen, and constipation, and feeling kind of not like yourself, a little groggy. So we're trying to avoid that, especially as the surgical manipulation and fluids tend to settle out over the first 24 hours. So that nerve block is really important to have on board for then. Of course, not everybody is a candidate, but most people are. If you're not a candidate, we will talk to you about that on the day of surgery. And of course, if you have any questions, you can always ask your orthopedic surgeon to get in contact with us, and we will give you a call before your surgery. Or you can come in with a list of questions on the day of surgery, and we'd be happy to answer those as well.